what is your advice to parents and kids on preparing them for going back into the school building? How should they do that for those 2 to 3 days?
Yeah. So first and foremost, I was honored to represent a team from Novant that Superintendent Winston and the CMS board asked us to come and present our medical point of view on managing the risk of schools opening up. And it was a very it was a great discussion. A lot of questions, pertinent questions were asked. A lot of questions were coming in from families because it was streaming live, and family members were asking questions, passing it through the board members. And our job was to present the medical facts, and the decision rests with the CMS board. Ultimately, the decision is a family decision, right? It's a personal decision, and there are a lot of different factors that come into play, right? Whether or not you have elderly parents at home or grandparents at home, whether or not you have the ability to social distance, whether or not you have the ability to online learn. So there are many different factors that go into play. What I will say is that from a very basic and foundational standpoint, whether school is in, whether school is out, whether school is populated by X number of students or Y number of students, the fact remains the basics still need to be implemented, and the basics need to be followed. First and foremost, I always start with culture. Shared value. Healthcare is a shared value. That's the foundation. So every student, every family, every teacher, every individual who's connected to CMS must understand that this is a community effort. This is a community effort. What you do affects me, what I do affects you, and we're all in this together. So that's first and foremost. Secondly, everyone should be educated on the things that we talked about. Hand hygiene, don't touch your face, use a hand sanitizer after touching services or entering certain facilities. Masking. I will continue to talk about masking. Social distancing, okay? All of those things are very important because we know they work. Plain and simple, we know they work. And if we have everybody on board, everybody contributing their little part, okay, we can roll this back and get back to a more active community, a more active society. So foundationally, it's all the same things that we know work, and we just have to take that to the school school system, as well as the family household, because it's not only about CMS or the school system, right? It's about the family. It's about the children. It's about understanding that we're all in this together. It's about understanding, hey, you need to wear a mask, even if you're out, playing. If you can't maintain a physical distance, you need to wear a mask. And as a parent, reinforce that. It's very interesting, right? Kids are really smart, and kids like the pattern behaviors, right? Well, as adults, as leaders, we have to demonstrate certain behaviors that we want them to follow. If there's a deviation from that, trust me, a kid will find out and go down that pathway. But if we're all in on the same page, creating that culture, the culture of health as a shared value, okay, then I think we'll be fine moving forward.
Great information. That's great information. So when COVID hit my household, I was not prepared. I didn't have any food in this house. I didn't have my medicine. Only thing that I did have was a couple of bottles of Lysol. That's it. I was like, Oh no, I got to go grocery
like
shop.
gold, which is like gold in this day. That's like gold. So.
But unfortunately, they are gone because my boyfriend was spraying them. I'm like, you wasted the Lysol. What are you doing? But we just weren't prepared for it. The biggest thing was I was like, there's no food in our house. We were eating out all the time.
Yeah. Mm-hmm.
So what is your advice for people on how they can prepare now, just in case COVID does affect their household?
Oh, that's a great question. So to your point, basic staples, water, basic staples of food supplies, whatever that may be for an individual, dry goods, canned goods. I wouldn't say that you have to, stockpile, a bunch of food, but just the basics, Tylenol, things of that nature, would be instrumental. And maintain social connection. Reach out to your community, your neighbors. We're in this together. Don't. I'm a people person, right? And we're a community. And one thing that I've seen, we can talk a lot about a lot of different things over the last 4 months, but one thing that I've seen is the community coming together to support each other.
Yeah.
And so, reach out to the social network that you have, whether it be church, your neighborhood network, your professional network, if needed, because you'd be surprised. I know you're not surprised, but there's a lot of folks that have been stepping up and pulling together as a community, and that's been a beautiful aspect of this pandemic. We do care about each other.
Yeah. I told people that the outpouring of love that I received, even from people that I just never met, was just as much as important as the Tylenol. That was medicine, was the support, and that's so important. So I did a lot of FaceTiming. A lot of people wanted to FaceTime and check in with me. And even like you said, for my mental health, I was calling people and FaceTiming them because I wasn't able to see people. So
that's a real big shout out that you just slipped in there, mental health. Okay.
Mm-hmm. Yeah.
That's huge during this time. There's a lot of stress going on for folks and households for a lot of different reasons. Some directly related to family members who may be sick with COVID in a hospital setting. Actually, some family members may have individuals that passed away. Okay. You have individuals that are unable to work. You have individuals who are essential workers who are in the front line, and that's causing a lot of stress and emotional challenges. You have individuals at home all the time with young children, homeschooling, as well as working from home and parenting. And so there is a significant amount of stress and anxiety out there, and I encourage all to seek resources, and if you go to Novant Health website, there are a bunch of resources for mental health, and there are other resources out there, not just Novant Health, but especially to our communities and to the folks that you reach, Jessica. It's important that we don't ignore that. Okay,
yeah.
It's real. It's important. It affects all of us.
Mm-hmm.
All of us.
Mm-hmm.
Okay. I just want to make that clear. There's certain individuals that say, oh, it affects this group of folks and that group. No, I'm here to tell you it affects all of us.
Yeah.
And we have to take it seriously and take the appropriate steps to address it.
Yeah. I know I want to close out, or I can't take any more of your time. I want to close out. For me, one of the most important messages that I've been trying to share with people is step one in this needs to be recognizing your symptoms, test, quarantine. Those three things are all step one. Because I think that people are going, well, I know people are going, oh, I have symptoms, I'm gonna wait a couple more days. And then
I don't mean to cut you off. Can I interject?
Mm-hmm.
Step one, prevention.
Yes.
Prevention.
Yes.
That's the best
the
way
mask.
to deal with this. Prevention, right? Hand
Mhm.
hygiene, masking, physical distancing. And then I would say,
There
yeah,
and that's why you the expert, cuz. That's why you the expert, cuz. Yes, so step one is making sure is prevention, making sure that you're knowledgeable about things. But then also when you get it, don't waste time. Don't
correct.
waste time. Don't, wait for the symptoms to sort of build up. Then go get your test. Then, then wait for your test results. And then that's when you start quarantine.
Correct.
You have to move quick and you have to do all of these things up front. And because what I told people was my first symptom showed up on Wednesday.
Mm-hmm.
I immediately acted and went and got tested. But if I had not quarantined,
Mm-hmm.
I would have been out between Wednesday and Sunday.
Mm-hmm.
And there's no telling how many people I would have passed the virus on to.
Absolutely. And that's a
All of those
huge
things
take-home message.
are
Absolutely.
one step, and they need to be done quickly in the beginning. That's the message that has been very heavy on me and that I want to share. But I want to ask you as the expert, what is your message that you definitely want our community to know?
I will piggyback exactly on what you said, which is one, make yourself aware of information regarding COVID-19. What do I mean by make yourself aware? How do you catch it? Well, usually it's through close contact, respiratory droplets. Somebody usually coughs, sneeze on an individual. Somebody coughs into their hand and then shakes somebody else's hand. That individual then touches their face. Okay, so educate yourself on how COVID is transmitted. Once again, usually through droplets. Can you cough on a surface, okay, like a refrigerator handle door, and then somebody else comes and grabs the door and then touch their face and catch it? Yes, you can catch it that way. Less likely, but you can, okay?
I mean, somebody's droplets count on me, Doc. Like,
it could be anywhere. That's the thing. It's hard to know where it comes from. But if we practice certain behaviors all the time, it's less likely for that to occur. So educate yourself. In information, you can go to your platform, Novant.org platform. A lot of information out there. So that's number one. Number two, take it seriously if you think you may have some symptoms. So once again, I use you as a great example. You began, not just you, but your household right away began to take steps in terms of intervention and or prevention, such that your boyfriend did not, become more exposed to it and therefore catch the disease process. So you quarantine early, you practice physical distance early, and you mask indoors. Yes, you can mask indoors.
Yes.
Right. And then lastly, it's not a ding if you catch COVID, right? It's not. So don't be ashamed to educate your community as you're doing, Jessica. You're not. Ooh, Jessica, let's stay away. No. Yes, it's a virus. Yes, folks get sick, but I would rather have folks use their own personal story, because a personal story often hits home much more than scientists talking heads talking and things of that nature. Oh, my cousin got it, my neighbor got it. I went out, I didn't believe it, but I went out and hung out, and then I got it. I mean, that's the story we want to educate our community on, that it's real. It's okay to talk about it. As a matter of fact, we should be talking about it. We should be educating each other. And then lastly, we must understand that we're in this together. We're in this together. Let's continue to lean on each other as a community. Let's continue to educate each other as a community. And we're going to get through this. We're going to get through this because we have a lot of other challenges that we need to deal with too in our community.
Yes.